Autoimmune cytopenias are quite a common complication in chronic lymphocytic leukemia because chronic lymphocytic leukemia is characterized by several immune alteration and immune dysfunction which are responsible for some clinical manifestations such as the high susceptibility to infection and the occurrence of autoimmune cytopenia. I mean the occurrence of autoimmunity in general, and then the more common form of autoimmunity are autoimmune cytopenias. Among autoimmune cytopenias, the most common forms are autoimmune hemolytic anemia, and which can be either warm antibody or cold antibody autoimmune hemolytic anemia, and immune thrombocytopenia. Usually the management of autoimmune cytopenias really depends on the status of the underlying CLL. So when the CLL is in an inactive state, then usually the treatment is directed to the autoimmune phenomena and is based mainly on steroids and intravenous immunoglobulin in the case of warm antibody hemolytic anemia and ITP, whereas is mainly based on rituximab in the case of cold antibody hemolytic anemia. Unfortunately, usually the autoimmune cytopenia respond well to the first-line treatment in most of the cases, but then the relapses are quite common and recurrent. And so now we know that the treatment scenario of CLL has dramatically changed in the last, let's say, 10 years. And so one question that came up was what is the action, what is the impact of new targeted agents on the outcome and the occurrence of autoimmune phenomena, and particularly of autoimmune cytopenia. And so we ran an observational retrospective study, which has been a very large collaborative study between more than 40 Italian centers, aimed at evaluating the impact of treatment with targeted agents, ibrutinib, idelalisib, and venetoclax, on both pre-existing treatment and treatment emergent autoimmune cytopenia. And what we found out from this study was that usually the three drugs, treatment with the three drugs, have a beneficial impact on pre-existing autoimmune cytopenia, so on the outcome of a pre-existing autoimmune cytopenias. We had very low recurrences, and most of the active autoimmune cytopenia were improved or even resolved by the treatment. And then we looked at the treatment emergence, so the new onset autoimmune cytopenia, and what we found is that patients receiving venetoclax treatment, but in our cohort I have to specify that venetoclax was administered mainly as a single agent treatment because at the time was the only indication approved in Italy. So those patients receiving venetoclax treatment have a higher frequency, higher incidence and incidence rate of autoimmune cytopenia compared to ibrutinib and idelalisib. So when we have thrombocytopenia or anemia in a patient receiving only venetoclax, we have to think that there might be an autoimmune origin behind of that.